Good evening. Thanks for joining us and welcome to the Adolescent and Adults with Spina Bifida and Hydrocephalus, Navigating the Health and Wellness Journey Across the Lifespan webinar. Your host for this session is Hydrocephalus Canada. I'm Shauna Bodway, the Director of Programs and Information at Hydrocephalus Canada, and I will be the moderator for tonight's session. The event is generously sponsored by the Sick Kids Foundation. Tonight's session will focus on understanding the effects and related medical focuses on spina bifida and hydrocephalus throughout the lifespan and the relevance and impact of transition care and support. Please note that the speakers tonight are not recommending any specific course of treatment. Always speak with your healthcare providers about any course of treatment to ensure it is right for you or your child. Our presenters today are nurse practitioners Dilshad Kassam Lalani and Abby Varghese, and student nurse practitioners Carly Turner. Dilshad is a nurse practitioner at Holland Bloorview Kids Rehab for 17 years and has experience in nurse practitioner and caring for clients across the lifespan and healthcare systems. In the last 7 years, she has provided care to youth and young adults with spina bifida and hydrocephalus and spinal cord injury, specializing in primary health care. Dilshad uses her experience in primary health care to provide leadership in the development and delivery of a comprehensive healthcare model, which encompasses transition care and support for adolescents and young adults with spina bifida and hydrocephalus, with an interprofessional framework. Dilshad's practice is embedded in principles of strength-based, family-centered, and developmental care. Dilshad aims to provide evidence-based spina bifida and hydrocephalus care and promote seamless transition from pediatric to adult care systems. Dilshad actively engages in research, education, and quality improvement projects. She is cross-appointed to the University of Toronto as an adjunct lecturer and preceptor, and also to Vibrant Healthcare Alliance to continue to provide spina bifida and hydrocephalus care and transition until the age of 25. Carly Turner is a graduate student at Toronto Metropolitan University's Primary Healthcare Nurse Practitioner program. Soon after graduating with a Bachelor of Nursing in 2015, she found her passion in neuroscience nursing at the University Health Network. She has experience working with spine and neurosurgery patients throughout their surgical journey in the operating room, recovery room, and inpatient unit. As a nurse practitioner student, she wants to practice upon a foundation of social justice, equity, and health as a human right. And lastly, Abby Varghese is a nurse practitioner from the Pediatric Urology Department at the Hospital for Sick Children in Toronto, and she collaborates with the Spina Bifida Spinal Cord Injury Program through a formal partnership between Sick Kids and Holland Bloorview. Please welcome Dilshad, Carly, and Abby to our session tonight. And I'm going to now go off and I will leave the session to you.
Hello, everyone. Thank you so much for joining us tonight. And thank you to Shauna for the invitation to present this topic that is close to our heart. And I'm glad to co-present with both Carly and Abby Varghese.
Thank you very much, Shauna. Hi, everyone. It's so nice to meet you all. Very, very happy to be here tonight. Having been an RN for about 7 years now, I'm currently working in the recovery room. I have lots of experience with neurosurgery patients and spinal cord injury, but over the last 3 months working with Dilshad in the Spina Bifida clinic, I've really learned a lot. So I'm really happy to share the knowledge that I've gained with you tonight.
And thank you, everybody, for also having me join with the program here as well. I work at Sick Kids, and I work collaboratively with the Spina Bifida program as well.
Thank you, Abby. So the one point that I wanted to start with is spina bifida is stable in adulthood. With that preface, I'd like to start with our objectives will include understanding of high level of spina bifida and hydrocephalus, understanding the impact and related medical focus of spina bifida and hydrocephalus, and also understanding the relevance and impact of transition care and support on the transition trajectory from pediatric to adult healthcare system. I present to you today with a case study, and I will read this case study for you. A 45-year-old woman with lipomyelomeningocele, neurogenic bladder requiring clean, intermittent catheterizations, neurogenic bowel, status post appendicostomy, tethered cord syndrome with detethering complicated by meningitis, Arnold-Chiari malformation type 2, multiple orthopedic procedures, and lower extremity weakness. That is my record. I have had 11 surgeries. I require catheterizations and medications to maintain renal integrity. Nightly, I flush the appendicostomy. Despite this, I have a fragile grasp on continence, exacerbated by any change to my routine. I became pregnant once with an early miscarriage, precipitating uterine prolapse. Further pregnancies were discouraged as any loss of pelvic integrity jeopardized my continence. We adopted a beautiful girl. I exercise and stretch daily and attend physiotherapy weekly. Without this, climbing stairs is challenging. Recently, my hands have become weaker. The etiology is unclear, but it is attributed to recurrent tethered cord. There is no evidence for treatment. Unsurprisingly, my medical record misses features that truly define me: physician, wife, mother, sister, daughter, mentor, and friend. Without my medical record, most would not recognize the challenges. The scars are well hidden, and my medical regimen is tightly controlled. However, the effort to appear normal, in quotation, is exhausting and isolating. I truly appreciate and love this story. And for me, the most striking thing about this case is the last paragraph that I have bolded for you. This woman poignantly points out that she is a physician, wife, mother, sister, daughter, mentor, and friend. And without my medical record, she says, most would not recognize the challenges. The scars are well hidden, and her medical regimen tightly controlled, and taking great effort to appear normal, in quotation marks. And so today's presentation is framed around the whole person and strength-based care. To that, I'd like to share that I live with my husband. I have 3 daughters who also live with me when they're at home, and their 3 dogs who are always at home. Therefore, I end up taking care of them. Okay. So understanding spina bifida, I just thought I would share with you some facts. We have about 120 to 150 babies born with spina bifida every year in Canada. It is the incomplete formation of the spine and spinal cord, and it is under the category, medically, neural tube defects. There are 3 types of spina bifida. You've got the spina bifida occulta, the meningocele, and the myelomeningocele. The myelomeningocele is the most severe type. The opening in the spine allows the spinal cord to be exposed, and it's caused by a failure of the spinal column to close early during fetal development. There are varying degrees of paralysis and loss of sensation in lower extremities or legs, as well as impacts on bowel and bladder function, hand skills, vision, hearing, and learning abilities. Most often found during the routine anatomical ultrasound at 18 to 22 weeks of gestation. Myelomeningocele are surgically treated after the baby is born, but in some cases, surgeons may be able to repair this while the baby is still in the mother's womb. I wanted to bring your attention to a study, a randomized control trial that was done with regards to prenatal versus postnatal repair of the myelomeningocele. And this study found that those babies that were repaired prenatally actually did well from a neurological standpoint. You may have heard about this study, but I really wanted to share it with you. So hydrocephalus, often associated with spina bifida, is the buildup of cerebrospinal fluid, CSF for short, around the brain. The purpose of CSF is to protect the brain and spinal cord. When there's too much, however, it can be dangerous. There are varying degrees of accumulation, similar to the different types of spina bifida, that can easily be detected from resulting enlarged ventricles, or these pockets, to being undetectable. Most common treatment is to insert a tube called a shunt to drain the excess fluid from the head to another place where the body can remove it naturally. There are 4 types of shunts. We have a VP shunt, or ventricular peritoneal shunt, which is the most common, and VP shunts drains from the ventricles to the abdomen. Then we also have a VA shunt, which is the ventricular atrial shunt, which moves fluid to a vein. Ventricular pleural shunt, it moves fluid to the chest around the lungs. And finally, ventricular gallbladder shunt, which moves fluid to the gallbladder. So, having said all this, what should the medical focus be? Spina bifida is the most complex chronic condition compatible with life. So therefore, we need to decide what the focus should be. And I quote for you, healthcare providers for adults with spina bifida should recognize the impact of executive dysfunction and nonverbal learning disability on self-management, independent living, and employment in adults with spina bifida. So here we are talking about the whole person again. We're not just talking about the medical complexity. We're talking about the impact on self-management, on learning, on independent living and employment. So how do we do this? It is a childhood condition, and therefore transition care and support makes this possible. So why is a well-planned transition important? Who should be involved? We know that unsuccessful transition has been associated with decreases in health and increases in morbidity and mortality, which is thought to be directly related to the lack of good adult follow-up care or delayed care. So therefore, everyone should be involved in the transition process. So transition and transfer are not synonymous terms at all. People often think that they are, but transition is a developmental stage that involves a significant milestone. For example, moving from a primary to a secondary school, moving from a secondary school to a workforce. Transfer, on the other hand, is an act or process of moving someone or something from one place to another. Transfer does have an element of transition with a defined endpoint that may vary from person to person. What are the goals for having a successful transition? Decreasing morbidity and mortality is obviously our goal. Morbidity speaks to progressive condition, getting more sick, and mortality speaks to death. Secondly, building the individual's capacity to participate in his or her own care. Building the individual's capacity to participate in his or her own community, and also providing uninterrupted and coordinated care. The main goals of transitioning, we continue, with regards to decreasing morbidity and mortality is, I wanted to point out that renal failure and shunt failure are the two main reasons for death in persons with spina bifida. The risk of urological and neurosurgical deterioration remains the same throughout adulthood as in childhood. Hence, positive health behaviors become super important, which we will get into a little bit later. So therefore, building an individual's capacity to participate in his or her own care and to be able to participate in his or her community by providing the tools to do so. And our focus is to optimize during this transition trajectory. Our goals are really, from a healthcare standpoint, to optimize the individual's health prior to adulthood. We want people with spina bifida to be as healthy as possible on that final transfer. We know that a successful transition is also dependent on the interdisciplinary team to provide the best care possible and to assist with transition preparation. This includes the availability of psychosocial supports. Interdisciplinary team members, including social workers, career counseling, life skills counseling, occupational therapists, social worker, psychologists, physiotherapists, nursing, and medicine. It's quite a large team for a very complex condition. McMaster University has identified research has shown that social support is critical success factor for any transition. There has to be an emphasis on a person's life course and the network of relationships. Key part of transition process is attaining the skill to self-manage and to navigate the system. The medical community has not done a good job of transitioning young persons to adult health care systems. We know that, and the research has told us, and you have told us. So what are the challenges of achieving a successful transition? Well, the interplay between family, school, community, and health system is quite complex. Family dynamics, healthcare systems that are not well coordinated or disorganized, and of course, the community and schools that can also be very complex. Challenges that are related to adolescent period include the brain. The prefrontal cortex, so the front of the brain, which is responsible for self-management and self-regulation, is not fully matured during the teen years. Chronic and medical conditions common to challenges with impaired executive function, which takes place in the prefrontal cortex again, makes self-management and self-regulation even more difficult. Then the inability to envision the future and understand consequences, which is due to normal adolescence and impaired executive functioning. All these present great challenges for achieving a successful transition during teenagehood. Why does this matter for adolescent and young adults? Well, we have a double whammy effect. Having a chronic health condition leaves the adolescent more vulnerable to physical and mental conditions, including those caused by poor lifestyle choices. We know that young adults can flourish in life if they learn the skills that are necessary. The burden to the individual, the family, and society will increase when adolescents and young adults neglect to manage their condition. So let's talk about a transfer as opposed to transition. What makes that transfer, that jump, successful? We know that our cortical medical history is very important. We know that communication tools between pediatric and adult providers is also key. And of course, the 4 P's of transition: people, process, paper / portal, and place. Some of us still like using paper, but a lot of us are now accessing the portals that the hospitals offer to access health information. And I can't say enough about accessing your portal so that you can actually be in charge of your information. You can access it whenever you want. You can learn about your condition and know yourself as much as possible, because you will always be the expert of you. So is this transition and transfer being successful possible? Well, absolutely, it is. And we've seen it being successful, but we've also seen it done not so well. So the points to remember when helping teens and young adults, these quotes, I love these quotes by Alfred Henry Lewis. Life ain't in holding a good hand, but in playing a poor hand well. I thought that was well said. And Carl Picard, coach the young person in how to play the hand he or she has been dealt. So then that brings me to, some of our parental role, including myself, because I do have a middle daughter with a chronic condition. Our parental role changes during teenagehood, and it must, especially for those parents who have teens, adolescent, young adults with chronic conditions and complex as well. It has to change to more over to a coaching role. And it's time to hand over the baton of responsibility to our teens. And the only way to do that is to coach, but not by parenting. The parenting piece will never work with teenagers, ever. They are looking for independence. And so telling them what to do is not going to work for them. However, coaching them, teaching them as to how you managed or navigated through the healthcare system is so critical. Making sure that the young person understands his or her diagnosis, the medication, side effects, how to order them, how to order their catheters, that sort of stuff is very, very important. So some of the enablers to a good transition and transfer to adult care system in the Spina Bifida transition program include adequate preparation of the young adult and parent, flexible transition timing, early introduction to adult clinic, not at 18. You can have a warm handover at age 17, 17 and a half. No interruption of healthcare services, so that delayed care can be avoided because we know that it causes increased morbidity and mortality. And up-to-date medical summary that is portable and accessible. So you can carry your information with you to the adult care system. So the Canadian Association for Pediatrics Center came out with some guidelines around transition in 2016. These included that the transition programs be built and be based on person-centered, youth-focused, and family-centered, should be inclusive or personal choice, and is adaptable to the abilities and complexities of the youth's needs. Address the youth's physical, developmental, psychosocial, mental health, education, lifestyle, cultural, and financial needs. And they also made some clinical recommendations as well as system recommendations. So based on these recommendations, in partnership with Toronto Rehab, we at Holland Bloorview have a lifespan model for transition, whereby our some of our patients, particularly with CP, cerebral palsy, are transferred to this transition program age 16-ish. And during their initial appointment in the pediatric service, we have an NP who discusses disability tax credit, registered disability savings plan as early as eligible. She also discusses primary health care, i.e., securing a family physician, because we all know that this is extremely difficult and even more difficult since COVID, and provide care with a do with philosophy as opposed to do for, which we are sometimes used to coming from the pediatric healthcare system. So at age 16, there's discussion about registration with the Developmental Service of Ontario if have a confirmed intellectual or developmental disability. And the confirmation would come from a psychoeducational assessment by a psychologist. At 17 and a half, we discuss applying to Ontario Disability Support Program for income support after age 18. And we talk about guardianship with healthcare providers for after youth turns 18 years old. So the program that I work in the Spina Bifida and Spinal Cord Injury Clinic, was initially a pilot, 2-year pilot project, which was successful, and then we had permanent funding. And it was through the Toronto Central Local Health Integration Network, as it was called then. And there was the addition of an adolescent related service in the Spina Bifida clinic at Holland Bloorview. And it also had a partnership with the Community Health Center for continuity of care. And within this program, there's ability to follow individuals with spina bifida up to age 25. This is a model that depicts our transition model at Holland Bloorview. So here we have a pediatric spina bifida clinic, and within it, we have an adolescent transition clinic, which I manage. And we have on the other side, a young adult spina bifida transition service through our partnership with Vibrant Healthcare Alliance, and some of you may know it as the Ann Johnston Health Station on Yonge and Eglinton. So within this model at the Vibrant Healthcare Alliance, we have ability to have primary care within Vibrant Healthcare. Should patients not be able to find someone, a primary healthcare provider locally or on their own. And then we have partnerships with adult specialists, community primary care physicians who are local, adult rehab, and of course the broader psychosocial supports. Vibrant Health is a community health center which also has a multidisciplinary interprofessional approach to care. So they also have social workers, physiotherapists, OT, dietitians, nutritionists, chiropody for foot care. And so Vibrant Healthcare Alliance was a perfect fit with our Spina Bifida transition program, and it's been doing quite well. And you'll notice in the middle that you have a nurse practitioner who is the point person who helps with the coordination and provides seamless transition across the trajectory. So this nurse practitioner works here in the Adolescent Transition Clinic at Holland Bloorview, but also at Vibrant Health. So I have the privilege of following the patients who I work with at Holland Bloorview right up to age 25. And I could see them develop, and it's quite a joy. Some of the resources that we had developed and piloted included a self-management app whereby people with adolescent with spina bifida spinal cord injury could actually access, input their health information. And we also had an area where they could access health resources within that app. And of course, their care team. And then some of the other resources that we use are more of a checklist type of a booklet and some transition documents that teach about how to articulate your diagnosis and its impact. And some of these resources include My Health 3-sentence summary, My Health Passport, and these were created by the Hospital for Sick Children. So some of the community supports that change into adulthood, generally these support services will often transition at age 21 and not 18. The pediatric specialist discharge at age 18. I discharge at age 19. And the community care support services discharge generally at around age 21. There are funding changes as our adolescents enter into adulthood. The pediatric funding, which stops at or before turning 18 years of age, such as Easter seals for incontinence supplies, assistance for children with severe disabilities, special services at home, enhanced respite, and disability tax credit, often to be renewed around the 18th birthday because it switches over to the young adults. So the adult funding that starts at age 18, if the application is completed, is the Ontario Disability Support Program and Developmental Service of Ontario, which includes the passport funding. And this funding, passport funding, could be used for respite, it could be used for day programs. And so really the person with the disability gets to decide, or their guardian decide on which programs they want to access in the community. So I just wanted to provide you with an update, transition update. This past year, we had the quality standards published by Ontario Health, and as well as the Maternal Child Health Committee. And then subsequent to that, we had the Canadian Pediatric Society position statement that was published. The Canadian Pediatric Society statement and included a call for action and recommendations to improve transition to adult care for youth with complex healthcare needs. And that was in April. The principal authors were Aileen Chalani and Ian Willem Gorder, Megan Harrison, and the Canadian Pediatric Society. So the CPS statement summary, I'd like to provide a summary by Dr. Talani, who gave a presentation, and she beautifully summarized the statement, and I would like to share that with you. So basically what they have found is that the current configuration of distinct pediatric and adult care services boundaries is fragmentary, raising barriers to continuity of care. So we're basically still there during an already vulnerable developmental period. For youth, the lack of care integration across sectors can negatively impact health engagement and jeopardize health outcomes into adulthood. So once again, we're still there. We're still working towards making transition more seamless, but obviously we're not there yet. To address these barriers and improve transition outcomes, pediatric and adult care providers, as well as family physicians and other community partners, must collaborate. So we're still talking about collaboration, but in meaningful ways to develop system-based strategies that streamline and safeguard care for youth transitioning to adult care services across the board, across tertiary, community, and primary care settings. So there is this call for action. So the core components of successful transition continue to include start transition planning early, create an individualized transition plan, provide support before transition, and ensure ongoing support after transition to adult care, and identifying a champion, a clinician who takes responsibility for facilitating and coordinating the healthcare providers involved in a young person's care, including primary care, and ensuring effective communication throughout the process is beneficial. We've known this. So this is recapping the literature and the research up to this point. The takeaway points by, according to Dr. Talani, are basically transition is an ongoing process. Practitioner can support youth in achieving greater independence and responsibility for self-management over time. See, this whole thing about over time is critical. You know, it's small jumps, no big leaps is the best way. Transition plans should be holistic, addressing service and life transitions and tailored according to the youth's needs and capabilities. So it's again looking at that whole person. I will now hand over to Carly to speak to us about healthcare across the lifespan and some of the preventative measures to ensure good health.
Thank you so much, Dilshad, for that amazing overview on both transition and transfer. Advancements, I've been amazed at the advancements in medicine and technology that have helped people living with hydrocephalus and spina bifida lead longer and healthier lives, even as evidenced by the ability to go in while the mom's pregnant and repair the myelomeningocele on the fetus. That's just truly amazing. We have come such a long way. However, adolescents who are transitioning into the adult healthcare system still face lots of barriers that put them at risk for decline in health over time. And people with spina bifida and hydrocephalus, they have to protect themselves against health problems that the general population face. That includes stuff like diabetes, hypertension, cancer, in addition to problems that may be more specific to their diagnosis. Our aim is to maximize the management of each person's unique needs and build on the foundation for the best possible quality of life into adulthood. Everybody's clinical presentation is going to be different depending on the type of spina bifida you have, the location of the lesion. That's why no two people are put into the same box. The care is always going to be tailored. The research is saying that even though we have come a long way, transfer into the healthcare system from peds to adults is very difficult for people with complex health conditions. Some of the barriers mentioned in the research are lack of multidisciplinary care in the adult system. In pediatrics, everything is very team focused, family centered, developmental focused. But the adult healthcare system is much more focused on independence. It can be hard to get appointments with all the specialists you need. They might want to schedule at different times. There could be limited resources in the system, especially with the ongoing shortages caused by the pandemic. Research does indicate that there's poor coordination and communication between the adult and pediatric healthcare sectors, which is something that we're working on. Lack of preparation or information, which should be started in childhood to help you transition. If you're not ready, then the transition can be quite difficult. Just some things that are extra challenges for people with hydrocephalus and spina bifida. You're at risk for a Chiari-2 malformation, and that's associated with learning disabilities, executive dysfunction, and that you could also have strabismus, early onset puberty, epilepsy. Those are problems that the general population doesn't normally have to deal with. And people who work in primary care may not be equipped or well educated enough to help people with those specific problems. So that's why Dilshad was saying that you have to be an expert in your own care, and you might have to advocate for yourself and even educate healthcare workers, because most of them are willing to learn. There's just knowledge gaps there. Some of the most important things that primary healthcare providers may not be aware of that are specific to people with spina bifida are caring for your bowel and bladder. There may be differences in social inclusion. The approach to living a healthy lifestyle might look a little bit different, mental health care. And of course, sexual health education is going to look a bit different for somebody with a disability. That's why at Holland Bloorview, we try to start the process as early as possible, even beginning in infancy, all the way up to when you're an adolescent. We're promoting that education piece. We're going to continuously assess your needs as you grow up, and we're going to try to give you the tools that you need to take care of yourself for the rest of your life. Okay, next slide, please. I just want to preface by saying that all the information that I'm giving today comes from the guidelines for care of people with spina bifida, which is from the Spina Bifida Association. That's an American association. And these guidelines aren't standards of care necessarily. They're based on the best available evidence and clinical consensus from all the experts coming together. Next slide, please. So one thing that we educate people with spina bifida from infancy, the parents help monitor, is tethered cord syndrome. Tethered cord syndrome occurs when scar tissue in your spine can prevent your spinal cord from growing with you. And that needs a surgical correction. So some things to be aware of are if you're having back pain or shooting pain in your legs, worsening arm or leg function, and that can include weakness, loss of sensation, worsening balance or coordination, worsening orthopedic deformities. Now you might already have something like that, but you just want to know what's normal for you. And if anything starts to become worse, then you want to pay attention to that and get assessed. If you have tremors or spasms in your legs that weren't there before or getting worse, you want to look for changes in the way your feet look. For example, if you have an orthopedic deformity, or it could be becoming worse, or there could be higher arches or curled, your toes becoming more curled. Scoliosis is the abnormal curvature of the spine. One of the signs of tethered cord syndrome is if this becomes worse. Any changes in your bowel or bladder function. So that could look like more increases in incontinence, urinary or bowel, or if you're starting to have more recurrent bladder infections. Any signs of these, you'll want to get checked out by a primary care provider. The next slide, please. If you have a VP shunt, some signs for that this could be malfunctioning are headache. That's the most common sign. Nausea and vomiting, seizures. It could be an onset of a new seizure or increase in frequency of seizures that were already there. If you have spina bifida, if you begin to have back pain at the spine closure site, any worsening in your arm or leg function. This is similar to what you might see in tethered cord syndrome, that it can include a loss of sensation, worsening balance or coordination, worsening orthopedic deformities. Again, if your scoliosis starts getting worse, if you're noticing changes in your speech or swallowing, and again, any changes in your bowel or bladder function that are different from what's normal for you. And these, if there's a problem with your shunt, it might start off as something vague where you're not quite sure what's wrong and you're not quite able to pinpoint it. But most of the time you will have a feeling that there's something wrong with your shunt. So make sure you bring that up with your primary care provider. And if they tell you that there's nothing wrong with your shunt, then just keep advocating for yourself, because you know yourself the best. And if you know there's something wrong, then keep on advocating for yourself. And next slide, please. Some signs of shunt infection include fever, tenderness at the incision site, abdominal pain, neck stiffness, redness, or any drainage or discharge from the shunt incision or tract. If you have a shunt, it may need revisions throughout your lifetime. So I thought it was a good idea to include the signs of an infection, even though infections are most likely to occur in the few months after you've had the shunt placed. Next slide, please. So one of the main priorities for people who have spina bifida is caring for your bowel and bladder, because a lot of times people are diagnosed with a neurogenic bowel and bladder. So bowel and bladder care is something that you're going to have to worry about for your entire life. And the care starts from when you're an infant. The main point to hit home is that kidney protection is going to be a priority for you regardless of your age. Bladder dysfunction, such as a urinary incontinence, recurrent urinary tract infections, chronic renal insufficiency, and end-stage renal disease, they're all potential problems that could occur at any time in your life, and they need to be very closely monitored. In order to make sure that your kidneys stay healthy, we will monitor with physical exams, kidney and bladder ultrasounds, avoiding cystourethograms, that's what VCUG stands for, urodynamic studies, and blood work. I just put a picture on the right there of what a VCUG might look like. The image is of a bladder full of the contrast dye, and it's actually showing a reflux that's occurring up to the kidney, and that is exactly what we don't want to see, and we want to prevent, because anytime that urine refluxes back into your kidney, there's a potential for damage. So that's why we're going to recommend a routine to keep your bowel and bladder healthy. And next slide, please. The best routine for you is going to be recommended based on your own clinical presentation and your abilities. The secondary goal is going to be social continence, because social continence helps you in so many ways, from your romantic relationships, employment. Being socially continent is one of the main goals. So we're always going to recommend based on your individual needs, and a stepwise approach is taken. We always try to use the least invasive measure first. In general, everybody should be drinking at least 2 liters of fluid per day, unless otherwise indicated by your healthcare professional. Fluid keeps your urine dilute. It flushes out any of the bad stuff. It prevents dehydration. Concentrated urine that's sitting in your bladder can cause stones. It can cause infection. And you don't want that to happen, because it can lead to damage in your upper urinary tract from scarring. Each person's bladder is a little bit different. Some people may be able to void on their own. Others will need to stick to an intermittent catheterization schedule. Catheterizing is very important, especially if you're not able to empty your bladder properly, because over time, urine can back up into your kidneys and cause damage, which is exactly what we're trying to prevent. So that's why we start teaching children early on to do clean intermittent catheterization as a part of their routine, even if it's not necessarily needed by that child. That can change over time. The function of your bladder can change at any time. So if you're already used to doing clean intermittent catheterizations, then you're already miles ahead, and you're already used to it. Another thing that we might recommend is an anticholinergic medication. Some examples are oxybutynin, myrbetriq, and solifenacin, and these help prevent incontinence that can occur in between intermittent catheterizations. If it's needed, we can do Botox injections into the bladder to prevent further leaking. People who have difficulty doing clean intermittent catheterizations by themselves, they may need a surgical procedure to help increase their independence. Some examples of that are the Mitrofanoff, the MACE, or the Monty procedure. MACE stands for Malone antegrade colonic enema, and this is a surgical incision placed into your abdomen, and it allows you to flush water through your rectum from the beginning. The Mitrofanoff is done by taking a part of your appendix to create a channel between the abdomen and the bladder to make catheterization easier. And the Monty is something similar. Next slide, please. Actually, never mind. Can you go back? Sorry about that. So another very important piece is taking care of your bowels. That's another benefit of drinking 2 liters of fluid a day. That helps prevent constipation. The goal should generally be to have 1 bowel movement per day. Everybody's a bit different, but we try to aim for 1 per day that's soft and easy to pass, just because you don't want fecal loading to occur. Stool that's hard and requires you to strain means that you're constipated. And if you have lots and lots of stool in your colon, then that can actually put you at risk for hemorrhoids and anal fissures. And it can cause your bladder to leak even more because there's lots of pressure pushing down on your bladder. So one of the first things we recommend if you're having issues with leaking in between your catheterizations is to make sure that you're emptying your bowels properly every single day. And we're going to recommend eating lots of foods with fiber and medications to help keep you regular. Those can include stool softeners, laxatives, enemas, suppositories. We're going to figure out what's the best solution for you. And if you're having trouble with putting in the suppository or the enema, then there is something called the Peristeen anal irrigation system. And it helps you become independent because you're able to inflate the balloon yourself. And it's a great tool to have. And if your insurance covers it, that's something that you can discuss with your primary care provider. Next slide, please. Another very important thing that should be talked about at your primary care visits is mental health. Mental health is important for every single person, especially people with disabilities. Mental health refers to our emotions, our feelings, our thoughts, how we perceive the world. Our mental health impacts how we feel about ourselves, how we cope with stress, how we relate to other people, and it impacts the choices that we make every day. Teens and adolescents with spina bifida and hydrocephalus are more likely than their peers to feel socially isolated and have low self-esteem, and that can definitely lead to depression and anxiety. I feel like the COVID-19 pandemic has definitely exacerbated a lot of mental health issues in everybody. So it's very important to talk about your mental health. If you have any feelings of sadness, anxiety, anger, or stress that don't go away or impact your daily life, the best thing to do is talk to someone you trust. Could be a parent, family, friend, teacher, whoever's a good role model in your life. There's lots of different things that influence our mental health. Could be our genes, biology, family history of mental illness puts us at an increased risk. Your life experiences, you could have trauma in your past, abuse. So a healthcare provider can take lots of steps to help you improve your mental health. The treatment that might be recommended could be finding a physical activity you enjoy. The research does show that increasing the amount of exercise you get makes you feel better. Mental health counseling, therapy, finding opportunities to socialize. I feel like nowadays we're definitely missing that face-to-face interaction. We're going to help you find ways to increase your independence. And even if those methods aren't working for you, we can start you on some medication. Another thing that might impact your mental health is bowel and bladder incontinence, which is why we try to help you become socially continent. Healthcare providers should be asking you questions about your mental health during visits. And if they don't, you can definitely bring it up if you feel comfortable. They might explore protective beliefs with you. Those include stuff like positivity, hope, optimism, attitudes, exploring your expectations for the future, help you come up with strategies to cope. And it's really important to show healthy behaviors like showing affection, bouncing back when things don't go your way, showing interest in learning new things, how to handle negative situations, and how to establish and maintain friendships. Your healthcare provider might ask you questions about your mood, your family, romantic relationships, any substance use. They'll help you create a plan to transition into adulthood that can include completing high school, finding a career. Having the plan in place will put your mind at ease and definitely improve your mental health. Next slide, please. Teens and adolescents who have spina bifida and hydrocephalus, the research does show that they have fewer social interactions. So it is a little bit more difficult for them to maintain friendships and have romantic relationships. And there's lots of reasons for this, and it could be your mental health is not in the best state. Your physical health is not in the best state. If you're having lots of pain, it can be challenging to get out there and make friends. Your social development, if you have problems with your executive functioning, then you might miss out on some social cues. Issues with incontinence can definitely impact your relationships. And although society has been making a lot of strides towards accessibility, there's still issues where if you have altered mobility, then not everywhere is accessible to wheelchairs and walkers and canes. So in order to help you with to optimize your relationships, your healthcare providers can explore community resources to help you become more connected to your community. This might involve signing up for adaptive sports, adaptive camps, scouts, and lots of other community programs. You might not know about them, but you could be connected to those. Next slide, please. Sexual health is a very important aspect to everybody's health. The World Health Organization hammers home that sexual health is a human right, and it's defined as a state of physical, emotional, mental, and social well-being in relation to sexuality. It is not merely the absence of disease, dysfunction, or infirmity. Sexual health requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences free of coercion, discrimination, and violence. For sexual health to be attained and maintained, the sexual rights of all persons must be respected, protected, and fulfilled. It's a human right for everybody. There is the unfortunate reality is that people with disabilities are at a significantly higher risk of sexual victimization than persons without disabilities. Sexual victimization refers to unwanted sexual contacts because the consent is not there. They haven't been able to freely give their consent, so they're being taken advantage of. This is more likely to happen, the research shows, in adulthood rather than childhood. Next slide, please. Adolescents and young adults are at a stage of exploring their sexual orientation and gender identity. Sexual health is very important for everyone, and although the education is provided in high school, starting in middle school and throughout high school, it's often inadequate to meet the needs of people with disabilities. I would say it's even inadequate for everyone. They could definitely be doing a much better job at educating our young people. So it's not surprising that people with spina bifida have less knowledge about sex than their peers. Youth with spina bifida may exhibit lower levels of sexual maturation, knowledge, and experience, the research shows. So it's very important that us as primary healthcare providers are equipping people with the knowledge that they need to navigate into adulthood. And these topics include contraception, sexually transmitted infections, what a healthy relationship looks like, consent, issues with fertility, cancer prevention, and cancer screening. In terms of contraception, it's important to always use latex-free condoms because people with spina bifida are at a high risk of developing a latex allergy. So we tell everybody with spina bifida, always use latex-free condoms. And that's very important to prevent sexually transmitted infections and pregnancy. The best way is to use both condoms and birth control. Women can start birth control for dual protection, and that's something that can be discussed with your healthcare provider. The sexually transmitted infections can be caused by vaginal, oral, anal sex. These are something that need to be covered again and again during education. Very important to prevent because they can have lasting impacts on your health into adulthood. And a lot of these sexually transmitted infections can be asymptomatic. So if you don't know about them, then you could have it and have damage to your pelvic region. Healthy relationships, they should be built on respect and communication. We always need to talk about consent. As I said, people with disabilities are at a high risk of being sexually abused. So we should start teaching about consent early on in childhood. No means no. And you shouldn't be touched in a way that you don't agree with. In terms of fertility, it's very important for people, regardless of whether you have spina bifida or not, to be taking folic acid if you're a female of childbearing age. It's especially important if you want to start planning a family. Women need to take extra precaution, and 4,000 milligrams of folic acid should be taken 3 months before conception, as well as at least 3 months after conception. And that's something that should be discussed with you well before you start to plan a family. Cancer prevention is very important. HPV vaccination should be given to men and women when they're younger, and cancer screening includes pap smears. Next slide, please. There's lots of steps that can be taken to ensure that your quality of life is good and you're living the best life that you possibly can. One of the best things you can do is to consume a balanced and healthy diet to prevent becoming overweight or obese. Becoming overweight or obese can have a negative impact on your health. It just makes it much more difficult to move, and it can put you at risk for a lot of diseases like cardiovascular disease, diabetes, hypertension. It's especially important for people with spina bifida to ensure that they're getting enough calcium and vitamin D for bone health. The recommendation for adolescents is to get 1,300 milligrams of calcium. Young adults need 1,000 milligrams. Vitamin D should be getting 1,000 international units per day. Drinking lots of water, getting enough sleep per night. Getting enough sleep per night is good because it helps with your development. Should be getting enough exercise daily. Getting enough exercise lowers your risks of heart disease, depression, type 2 diabetes, stroke. Also will definitely help improve your physical and mental health. You can talk to your healthcare providers, physiotherapists, OT. You want to make sure that all of your mobility equipment is up to date and fitting well. For example, if you have AFOs, walkers, canes, wheelchair, you want to make sure it's the right fit for you so that becoming more physically active is comfortable. The recommended is about 60 minutes of physical activity per day if you're age 6 to 17. And you want to get at least 150 minutes of physical activity per week, if not more, if you're over age 18. It definitely helps if you find an activity that you're actually interested in. It'll make it much easier to stick with that activity. Could be walking, rolling in the neighborhood with your wheelchair, going to the gym, swimming, finding adaptive sports that you're interested in. Another thing you definitely need to be doing is checking your skin daily for areas of redness and breakdown. You want to check all the areas that are at a high risk of pressure, any bony prominences, and your tailbone, your heels, your elbows, the back of your head. Any areas of redness that don't go away after 30 minutes or any open areas, bring that up with your healthcare provider to get it checked out. If you're having problems with incontinence, you definitely want to use a barrier cream to protect your skin. Next slide, please. Children and adults with spina bifida do have higher rates of being overweight and obese compared to the general population. And like I said, obesity can have some negative health consequences. So it's very important to get that good nutrition. Includes eating fruits and vegetables, whole grains, lean meats, and proteins. It doesn't necessarily have to be meats if you're vegetarian. There's lots of options for getting proteins in. You want to try to avoid foods that are processed, fast foods, foods with lots of added sugar. That can be like juice, chocolate milk, pop, sports drinks. So sometimes it's good that you get a lot of fluid, but the best thing to drink is water, because if you have added sugar in the fluid that you're consuming, then that can put you more at risk of being overweight. The research shows that being in the healthy weight category will lead to increased mobility, a better quality of life, and it will make it much easier for you to be independent. So your healthcare provider should be checking your body mass index, and your weight can be monitored by checking your waist circumference, and they'll make recommendations for you on how you can live a healthier lifestyle. Next slide, please. So I just wanted to highlight some organizations and associations that are good for information for people living with spina bifida and hydrocephalus. Of course, the Spina Bifida and Hydrocephalus Association of Canada, Spina Bifida and Hydrocephalus Association of Ontario, the Spina Bifida Association, that's the American association where we get our guidelines from. Lots of very good information. CanChild, Spina Bifida Families Association of Ontario, and Holland Bloorview has lots of really good programs. The one that we've highlighted here is called On Track, student-led and learning environments, and they help you with assistance in navigating your transition from pediatric to the adult healthcare system. Next slide, please. So I just want to end on a note that we have made lots of progress. We still have a long way to go, but we will definitely get there. And these are all the references that we used. Thank you so much for listening, and we really appreciate your time.
Thanks very much, everyone.
Sorry we went a little over time.
That's quite all right. Very interesting topic and presentation. There was a lot of good information in there. If there's any questions, please put them in the chat. I noticed that you took a lot of the information from the care guidelines that are from the SBA Association in the US. We actually have Hydrocephalus Canada actually has a partnership with um, the American Association, and a lot of the guidelines are available on our website at hydrocephalus.ca. I don't see any questions at the moment, but if there are questions, you can certainly email us at info@hydrocephalus.ca, and we can reach out to Dilshad and Carly to get those answered. So, oh, thank you. Andrea just popped that into the chat. Did Abby have anything else to add to the presentation?
Actually, Carly did a great job putting everything together, and I just wanted to highlight a few things, especially for the older population who has spina bifida and maybe has a Mitrofanoff channel. Around the time that women may be pregnant and with a developing fetus, it is important to know that maybe that Mitrofanoff channel might close during fetal development. And so often we ask to have that catheter placed in the stoma to be able to prevent any kind of occlusion of the stoma. And that still maintains the ability to drain the bladder. Another topic that we talk about that we've noticed for some of our pediatric patients who have VP shunts is during their MACE flushes, they may have sort of these shunt malfunction symptoms where the MACE fluid will actually, in fact, create an obstruction on the shunt tubing. Once that fluid sort of passes through, their shunt symptoms seem to alleviate, but temporarily for a period of time while that fluid is sort of sitting stasis in the bowel, they may actually have headaches and vomiting and lethargy. And then once that fluid passes through, a lot of the patients anecdotally have said that their symptoms resolve once that's through. So there's a few things here and there.
And is that when the MACE is first done, or is that a continuous process with the MACE that it could affect the shunt?
It depends really on the volume that each of the families have been putting into the MACE. So sometimes if you have large volumes of fluid and it's a little bit slow to have that fluid pass through, it could happen at any point in time during everyone's MACE journey. So it doesn't necessarily happen every single time you do your MACE. And Dilshad and I, we've seen a couple of patients through the pediatric clinic and adolescent clinic who have mentioned these symptoms, and we have yet to sort of collate enough patients to sort of put together to actually, do publication for this so that it's out there. But we have noticed that, and so hopefully we'll, start to collect more data from some of these families to be able to actually put it out for publication. But anecdotally, this is what we've seen, and we've noticed that once the actual flush goes through, these symptoms actually resolve. But it's important for older population to kind of know to be able to watch out for these.
And
overall, though, yeah, go ahead.
Sorry, would that be similar as well if adults have the cecostomy button?
It should be pretty much the same. So it depends on where your shunt tubing is and how much fluid it requires to be able to press up against the tubing itself. And so a lot of it is I think based on stasis of fluid within the bowel as they're, you're doing your antegrade flushes. And it also depends how much volume. These days, I'm finding our patients and the families are opting for more lower volume flushes, and we support that completely. You just need as much flush to be able to be continent and have a good response to the actual treatment. And then we will give guidelines based on weight as well as age and efficiency of emptying, whether to increase or decrease. But I'm finding that a lot of the families are opting more for more lower volume flushes. And so we may not see this often, but it's definitely what we see for those patients that are a little bit more sensitive for sure.
Very good to know. And for the adult population that might be looking for alternatives for catheterization and bowel management, where would they go to get the Mitrophanoff procedure or the MACE procedure done in the adult world?
Yeah, that's a good question. Definitely, Dilshad and I work very closely in trying to find the best providers for this. For sure, in Toronto, we do have a few sites, Sunnybrook in particular, that is specialized in the reconstruction for the creation of Mitrophanoff. I know that for MACEs, we do have many general surgeons that are actually doing this. This is, you know, a urology sort of interest that has picked up at Sick Kids, where, you know, urologists are doing MACEs. However, in Sunnybrook, because they do have the reconstruction expertise, they also do MACEs as well. But you can get a MACE through a general surgeon. But a Mitrophanoff for sure. Our go-to hospital is Sunnybrook.
Okay, perfect. And there is one question for all three of you. What resources are available for those over the age of 25?
I can leave that for Dilshad for sure.
Okay.
Sure. So resources. So I'm thinking in terms of the specific resources, whether they're educational resources, or I'm thinking maybe a healthcare practitioner, because I know that our program ends at age 25, although I have ability to push it to 29, depending on the needs. So what happens? What resources do you have? So the idea of the program that I'm in is that, you know, by the time you're 25, you should really know yourself well, and you and your primary care provider, right, should have enough information between each other, as well as my support, because I do support the primary care providers and sharing knowledge or treatment plans with regards to bowel, bladder, what have you. And so that's the idea, is to share that knowledge. And it becomes super important to have that close relationship, or a meaningful relationship with the primary care provider.
When you say primary care provider, are you talking about your family doctor or your general practitioner?
Yes, because when you go into the adult world, you don't have a point person like we do, like the NP position myself, to put the whole picture together and to help coordinate and manage that transition, that it can be as seamless as possible. Things are fragmented in the adult world. It's just how it works right now. And so because they don't have that point person specific to spina bifida, they have a point person for everything, which is the primary care provider. And they should be able to handle, and they may not know spina bifida as well as you or I, but they should be able to make decisions that will keep you safe, refer you, let you know whether you need to go to the ER or not, that sort of thing. But it's also up to us, us with specialty knowledge, as well as you, people with spina bifida, that do have to do a lot of teaching with primary care providers, because they do have an education around spina bifida, but it's not very much, right? And so it becomes critical, right?
Right. Between both conditions, spina bifida
Yes.
and hydrocephalus.
Yes,
So you are your best advocate when you get into the adult system, for
Absolutely.
sure. And if you're looking for resources, Hydrocephalus Canada always has resources available. And if we can't find them, if we don't have them readily available, we will find them for you. And that includes trying to connect you to healthcare providers as
Right.
well.
And Shauna, I should make 2 points a little bit more clear, in that although the adult care system is fragmented, right? Neurosurgical, urological health is monitored, and we do have specialists that do that part. It's just a matter of putting it together, right?
Right.
And often our patients will not have an orthopedic referral, right? Because at that age, they're pretty stable. If you're going to need an orthopod, it's not going to be until middle ages. And then at that point, the family physician, nurse practitioner can refer.
Or
Right.
if you're seeing a physiatrist, they could
Or
also do.
physiatrist. And in our practice, we do refer to physiatry, and the physiatrist almost becomes like a point person, right? Because that particular specialist understands rehabilitation medicine, right? And there's so much with function around spina bifida, right? That needs to be appreciated and understood well. And Abby and I, lastly, we do get calls from 60-year-olds, 40-year-olds, and we don't mind taking their calls at all. And we can connect you, or if it's something that we can answer for you, we definitely do.
That's wonderful to know. But if you do have a question for Dilshad or Abby, you can reach out to us first and we can connect you. Thank you once again to all three of you, Carly, Dilshad, and Abby. This was a wonderful presentation. And I'm sure that the people on the live version were very educated, and it'll be available to others on our YouTube channel. So thank you very much. Have a great night, everyone. And if you do have any questions that come up, please send them to us at info@hydrocephalus.ca, and we'll ask Dilshad, Abby, or Carly to answer them. Thank you so much, everyone. Have a good night.
Thank you for the opportunity.
Thank you very much.
Good night.